Two individuals, with somber faces, are immersed in conversation in a sunlit classroom. This image is the theme across WHO's 2017 campaign Depression Let's Talk that aims to encourage people suffering from depression or anxiety to seek help and get assistance. The fact that depression is the theme of World Health Day 2017 indicates the growing global awareness of mental health. This intensification of the discourse on mental health unfortunately coincides with the global rise in mental illness. According to the latest estimates from WHO, more than 300 million people across the globe are suffering from depression, an increase of 18% between 2005 and 2015. In India, the National Mental Health Survey of India, 201,516, conducted by the National Institute of Mental Health and Neurosciences NIMHANS, revealed the prevalence of mental disorders in 13.7% of the surveyed population. The survey also highlighted that common mental disorders including depression, anxiety disorders and substance use disorders affect nearly 10% of the population, with 1 in 20 people in India suffering from depression. Perhaps the most crucial finding from this survey is the disclosure of a huge treatment gap that remains very high in our country and even worse in rural areas. According to the National Mental Health Program, basic psychiatric care is mandated to be provided in every primary health center, the state-run rural healthcare clinics that are the most basic units of India's public health system. The government provides basic training for all primary health center doctors, and pays for psychiatric medication to be stocked and available to patients. Despite this mandate, the implementation of mental health services in rural parts of the country continues to be riddled with difficulties. In some rural parts of the country, a heavy social stigma exists against mental illness. This has been documented in many studies, including the NIMHANS study mentioned earlier. Mental illness is considered to be the possession of an evil spirit in an individual. To rid the individual of this evil spirit, patients or family members rely on traditional healers or religious practitioners. Lack of awareness on mental disorders has led to further strengthening of this stigma. Most families refuse to acknowledge the presence of a mental disorder to save themselves from the discrimination in the community. The average national deficit of trained psychiatrists in India is estimated to be 77%, 0.2 psychiatrists per 1,000,000 population. This shows the scale of the problem across rural and urban India. The absence of mental health care infrastructure compounds the public health problem as many individuals living with mental disorders remain untreated. The scarcity of healthcare services also means that poor families have to travel great distances to get good mental health care. They are often unable to afford the cost of transportation to medical centers that provide treatment. After focused efforts towards awareness building on mental health in India, the Love Laugh Foundation TLLLF, founded by Deepika Padukone, is steering its cause towards understanding mental health of rural India. TLLLF has joined forces with the Association of People with Disability APD, a non-governmental organization working in the field of disability for the last 57 years to work towards ensuring quality treatment for the rural population living with mental disorders. APD's intervention strategy starts with surveys to identify individuals suffering from mental illnesses. The identified individuals and families are then directed to the local primary healthcare centers. In the background, APD capacity building programs work simultaneously to create awareness about mental illnesses amongst community workers, ASHA workers, village rehabilitation workers and general physicians in the area. The whole complex process involves creating the social acceptance of mental health conditions and motivating them to approach healthcare specialists. Participants of the program, when mental health patients are finally free of social barriers and seeking help, APD also mobilizes its network to make treatments accessible and affordable. The organization coordinates psychiatrists' visits to camps and local healthcare centers and ensures that the necessary medicines are well stocked and free medicines are available to the patients. We spent a lot of money for treatment and travel. We visited Shivamogga Manasa and Dharwad Hospital for getting treatment. We were not able to continue the treatment for long as we are poor. We suffered economic burden because of the long-distance travel required for the treatment. Now we are getting quality psychiatric service near our village. We are getting free medication in Taluk and primary healthcare centers, resulting in less economic stress, a parent's experience at an APD treatment camp. In the 2 years TLLLF has partnered with APD, 892 individuals with mental health concerns have been treated in the districts of Kolar, Davangere, Chikkabalapur and Bijapur in Karnataka. Over 4,620 students participated in awareness-building sessions. TLLLF and APD have also secured the participation of 810 community health workers, including ASHA workers, in the mental health awareness projects, a crucial victory as these workers play an important role in spreading awareness about health. Post-treatment, 155 patients have resumed their previous occupations. To mark World Mental Health Day 2017, a team from TLLLF led by Deepika Padukone visited program participants in the Daventry district. Sessions on World Mental Health Day 2017. In the face of a mental health crisis, it is essential to overcome the treatment gap present across the country, rural and urban. While awareness campaigns attempt to destigmatize mental disorders, policymakers need to make treatment accessible and cost-effective. Until then, organizations like TLLLF and APD are doing what they can to create an environment that acknowledges and supports people who live with mental disorders. To know more, see here. This article was provided by the Scroll marketing team on behalf of the Love Laugh Foundation and not by the Scroll editorial team.